What's up, guys? Welcome to Brain Trash. This is the podcast where we talk about all of the things that we hate about psychiatry and all the things that we love about psychiatry too that just aren't talked about anywhere else. So today we're going to talk about a pretty hot topic right now and a pretty scary topic, which is the Autism Registry that has been proposed by RFK and the Human Health and Services Department. This is obviously terrifying for a million different reasons. As an autistic person, as a parent of autistic children, as just a human. So what's kind of going on with this? Tell me about what RFK have said, Tabitha. Why are we doing this registry?
Well, I feel like a lot of it is because of this narrative he has that it's this environmental thing that's causing it, right? His whole thing is like, we know that genes don't cause this. We're going to find that environmental toxin and we're going to just take it down, right? It's like we're going to go get it and we're going to kill it so it goes away, which also like just reinforces that negative stigma of like, this is something that's bad to have, basically.
Because they can't pay taxes. That's verbatim.
Use a bathroom or have a job.
Yeah, which I mean, is the existence of a lot of level 3 or sometimes even level 2 people who have who are autistic. And that was something that I had a lot in a TikTok video I made about the registry. There were comments from people being like, as parents of level 3 kids, we want to be heard and we want to be seen and we want to see these studies. And honestly, it makes me sad because they're preying on these families saying oh, there's hope, we're gonna find it. But if it is mold, how are they going to get rid of mold? Right? If it's maternal age, they can't get rid of that. What do you do? Right? There's just I don't understand. But what we do understand is that he's saying we're going to have an answer and we're going to have it quickly. And these are my hypothesis. This is my hypothesis. And this is going to be correct. And he's not saying we are going to find the cause, if it is genetics, if it's not, it's just it's not genetics, it is a toxin. So there's just a lot of issues in general. We both come from a public health background, so we both understand studies and how things are done. And you have to start at the question of what is it, not I know it is this, so I will go for it.
Right. Well, and I think a lot of what it is doing is going to just create this idea that we're looking for this thing, and you can very falsely within a set of data find things that are kind of the same about a group of humans, but also having to control for a lot of that and having to figure out, what type of bias went into this research. There's so much that goes on behind that. And when you do any type of healthcare leadership or public health or anything like that, where you are in some type of role that impacts these metrics and data, there's so much of it that is not captured in an electronic health record that they're going to use to create this registry. It doesn't compute when you look at the actual processes that are involved in taking a group of records and creating research out of that. There's just so much more to it.
And when we look about what's available to go into a registry, right? So we know that how healthcare works is that when we put in a diagnosis, it is coded. So for instance, autism would be coded as F84. And we put this in, insurance companies receive this, and essentially this is kind of a metric that you can use in reports to say how many people have this diagnosis. The insurance companies can use it to kind of track treatment, or say we know certain services are covered for this diagnosis, it's not covered for that diagnosis. So there's a code that goes with everything. It's called an ICD-10 code. So they can use that and they can receive all of that information, and they can get that information from labs. They can get it from health record systems. They can get it from insurance companies. There's a lot of places they can receive those codes and that information from to build that registry. But the question is what other pieces of information are they going to gather, right? So something that would be gathered would be vaccines, because there is also a code for vaccines to say if you've gotten a childhood vaccine. But what's not there? There's nothing exposure to mold is not in there. Exposure to environmental toxin specific is not going to be something that they can receive from those records to build this registry. So what they're doing is they're just building a very specific thing with a very specific end game. And then we had a whole conversation last night about how diagnoses are fairly dangerous because this is what could happen, right? Our names could just be on these registries.
Well, and I think too, it also prevents people from seeking necessary care. Like, I mean, how many people have canceled like an autism evaluation since finding out about this? I mean, I can't tell you how many patients I've had come to me and be like, hey, is this in my chart? And also, like, do you think I should still go get this evaluation done? It changes the implications of seeking out care in the first place, which I think is also a big part of the overarching plan, with because less people seek services, less people have a diagnosis of F84.0, right? And then now all of a sudden autism is cured because RFK did some research and put a registry and found out that it was this toxin that he eliminated because of his brute force and strength, like.
Yeah, and I mean, the people who will have to still speak those out for insurance purposes are people who have kids who are level 2 and level 3. So there will be a huge push to still have those, because in order to have things like ABA, to OT, speech, physical therapy, to have like an IEP sometimes, right? That's like very specific. You want that diagnosis. So those will be the people who are forced to still seek out that. And then it will be people who, like adults, late seeking people like you and I, who will not be getting diagnoses, because that's terrifying.
Yeah. Well, yeah. And this also like further skews the data, because if our only pool is of people who are really, really struggling from a young age with level 3 type needs, and then also, across kind of early humanhood, level 2's starting to notice, oh shit, I am needing a little bit more. We also lose that bit of, well, the large bit of level 1 humans, which the conversation around that is already kind of setting up for, hey, let's just kind of like shut up this whole subsection of autism because whatever. Like, I think RFK's argument there was that you can't look at these numbers and say that 99% of people were just missed somehow. But like when you actually look at people diagnosed in adulthood or late diagnosed high masking humans, like
It's us. We are the ones.
90%, right? Like, when our world is founded on ideals and systems that force you to mask, I think an increasing number of people who are missed or highly masking because they have to, because they're not safe to unmask. Um, to me, that number makes sense,
And just like looking at in general girls who are, like not diagnosed because the criteria has changed over time, and like that hasn't been in his conversation, that we've had different versions of the DSM, and like there was something called Asperger's syndrome, there was like a very different variation of autism, the DSM-3, there was childhood schizophrenia that in like the DSM-1 or 2 actually was autism. Like it was exactly autism. This person's not socially developed, they have repetitive behaviors, there's rocking, there's other types of things. So I mean, like there's
A lot
just,
of his conversation included those things. Like, he initially in the beginning talks about autism was talking about Asperger's, which we haven't utilized that as an actual diagnosis for a while now. And then he was talking about like, you know, uh really low functioning and we don't talk about that's not it either, right? So it was clear to me from day one that like he hasn't actually looked at
anything.
how this is impacting humans, the actual facts behind it. It's just that same, like, I guess, echo chamber of bullshit that keeps this type of shit in the dark for so long.
I think it really comes back to too, like he's trying to like utilize the voices of level 3 families to say, I'm hearing you and I'm listening and I will find a cure, or I will find the cause for this. But like we're ignoring the fact that like a good percentage of level 3 kids also have like a genetic comorbidity, right? And like there are other components that are like researched already, and it's not going to be like an easy answer. Then we have like the compounding thing of he's cutting, well, I mean, like there's almost $900 billion being cut for Medicaid in the next 10 years. So what happens to all the services for autism that are a part of that is like they're getting cut, and those centers are going to close. So, oh wow, I'm helping all of you families as I destroy all of the safeguards for you. And like, he's said before, like this comes back to like these people are not serving in the military. And I've said before, autism is an excluding diagnosis. And like, I think that they're planning to expand the military and they want more people. And that would be harmful for them if there were autistic people like being disqualified from that. They want everyone.
Right. Right. I think just looking at it like big picture from the diagnostic piece too, like this just further validates how messed up our healthcare system is. Like, we have to have a diagnosis code in there for reimbursement. So if someone's coming to us specifically for, say, autism, right, but they don't want that in their chart, we now are forced to either not be reimbursed for our services or find another underlying something that is diagnosable. But then you can take that person to two different providers, and based on their background, specialty, the amount of time they're allowed to spend with somebody and ask questions and stay curious, they might come up with two entirely different diagnoses. So then when you take that back to this like registry for whatever it is, right, whether it's autism or something else, this person from one provider would end up on autism registry, and from the other provider would end up on a generalized anxiety disorder and learning disability registry, right? Like,
That's so
the system that we have to do this is not something I think we can just fall back on for research purposes. I think that's very flawed and has a lot of room for error.
Yeah, and I think when this was originally built, like when you had public health registries and things like that, this is like for things like if you have a communicable disease, if you have measles, if you have like some sort of like disease that could be harmful to other people, they have you make a report as a healthcare provider. And that goes into a registry where they're able to track like back to everything you've eaten, right? And that's how they find the source of like E. coli or salmonella or things like that, is because these cases are all reported and they can all track back to say like they ate this one bag of salad. But like what happens when you have a bunch of like autistic people who are on a registry? That's not the same kind of end game of like we need to find out something to help the public, but he's playing it at like it is, and this is not the purpose. This is not public health. This is like it's just fucked up.
Well, and if it is something like that, right, it would be so fucking pervasive that we would either know something by now or it would be from specific regions. There would be different epidemiology markers that we would be seeing throughout time. It wouldn't, like, otherwise, it's going to be something so fucking vague that there's no way to say people who don't have autism also haven't encountered this environmental toxin that's causing the epidemic.
The epidemic, yeah.
Yeah.
But yeah, like that's the thing too, is like when you come from a public health background or a healthcare background, you can look at these things, but for people who don't, like they hear Robert F. Kennedy talking and they think it makes sense. But like you have to understand, like if you have looked at that and said, like, okay, I think I believe in him and I want to see the studies and I want to hear the research, like you have to know that there's research out there and there have been people here for like years and years and years and years with true interest in this who have been looking, right? Like, and there have been people who've studied how to set up a study. How do you set up research? How do you do this safely? Like, there's a whole field of study of public health. Like, I have a degree in it, you have a degree in it. Like, but people have been doing this. This is not something that he's just like taking out of thin air and now he's magically listening. He doesn't understand anything about this field. He's not a scientist. He's not a healthcare professional. He's not any of this stuff. So that's where like a lot of this criticism is coming in, is because it's scary for us. We're like, no, this is not how it's done.
Yeah, it's terrifying. And I think as I started to learn about these things when I was initially getting um, my first master's degree, like healthcare leadership, that kind of stuff, like learning about how we take this data and these metrics and make decisions based on that, I was already like, oh, fuck, there's so many holes in this logic, right? And I think a lot of people who want to support him and his ideas say, yeah, it's really fucked up and it's all bad. And so we need somebody who's just real forward thinking and is taking a different approach to come in here and do this. The problem with that is like, we still have to use actual science. It's not just, oh, hey, somebody has a really great idea that's new, right? Because sure, do I, would I love to know if there's an environmental toxin causing autism? Sure. Um, do I think it needs to be eradicated and taken out? I mean, I think there's a lot of things in our world that can be different, like
Look,
not having a system that is completely structured on 9 to 5 capitalism that neurodivergent people don't fit into in the first place. So,
also like smoking causes cancer, but we're not like taking it out. But also we know it causes cancer, but also like people are still smoking and like that's okay. But that's okay. Just so you guys know, it is an epidemic that so many people have cancer and it costs a lot of money. It is a chronic disease, but like it's okay if you smoke.
tobacco, though, they get the money off of that. So we have to let people still smoke and die of
Yeah.
lung cancer. We don't get any money out of autism, so we got to get rid of it.
And I mean, you can put like people in the military, they don't get cancer till later, probably. So that's okay. Yeah,
it's a real long arc to get to the death part of the smoking cancer, you know?
it's true. And there are a lot of like fears too around like trans people are highly represented in autistic communities. So there's like a lot of people who are very worried about like what if this is like a move on looking at that, right? And that's like scary too. Like I hear that this is like another way of control. And like if this registry does exist, like the Trump administration has already shown that they give no fucks about laws or privacy or like how to use things appropriately, and like they're arresting judges for like getting in the way and for trying to uphold the law. So like everyone is in the right for being scared.
Yeah. Well, and I think ultimately, like my message to people has been, obviously, if it's something where you need those services and you need the diagnosis to do it, cool. Otherwise, like finding a provider who is like affirming of these things, understands these things, and can safely walk you through this type of shit is really, really important. Something that I think about a lot in somewhat similarity, right, is like back in the day when the old DSMs were being used, I think a lot of times there was some, I can't remember what it was from, but there was a lot of evidence that Black men were being diagnosed more so with schizophrenia than they were for like bipolar or autism or anything like that, right? And this was because there was a lot of really like um, cultural assumptions being made by white providers who were meeting these people and saying, well, this couldn't be just, you know, silly old bipolar. Like there's a level of suspicion or paranoia when they're around me. And so that tells me that they are schizophrenia instead. Right. And so like same way when we look at if we were to pull data to do a study on schizophrenia, how skewed that would be from having all of these misdiagnosed people or overly diagnosed things where it feeds into this research and ends up bringing us to a place where we find out that like diagnoses and diagnostic approach varies greatly across lots of different people and affects things in a really big way, in a way that we can't say is like, oh, this is a surefire way to do this, you know?
And we know that like there are a lot of people who don't have access to get diagnoses. We know wait lists are like off the wall to get a diagnosis. Like my kid's currently on the wait list for getting services from the Regional Center of California, and it is a 9-month wait list. And even then they told me that the diagnosis that she had, because it was done by a nurse practitioner, was not sufficient. So I'd need to get another evaluation, and the evaluation was about a year out from the time that we did the intake. And I mean, like, that's California and we're a progressive state. What happens in like other states? I know Arizona, it could be like 18 months. That's like been the typical is 12 to 18 months for a diagnosis. There's places in the South that like there just aren't people diagnosing kids. So it's just like impossible. So like there's just so many missed, yeah, there's just so much data that can't even be like taken because there are so many people who can't get the diagnosis in the first place. And that's not what's getting looked at, is like let's make sure that we're taking care of everyone and we're like making sure people are diagnosed too, or like let's get services and like let's see what kind of services would be most beneficial. No, it's weird and it's for their own agenda.
Let's take away funding. Let's just pretend these things don't exist anymore and just eradicate them by using language that's very exclusionary, right? Like this is over and over and over what they do with each thing that is on the agenda.
So what we have put together is we put together a free guide that you can get on paperflowerinstitute.com. And this is a guide to help you understand the registry, what they have said about the registry, the laws surrounding what could protect us, what might be ignored, what are the implications of that, what kind of places are they getting, these diagnoses from, and what can you do to protect yourself. So that's all in our free guide on the website, and hopefully you guys can tune in for the next episode of Brain Trash. We're going to talk a little bit more about how diagnoses are complete trash and all of the other implications of having a diagnosis and why that is not necessarily a great thing for us. So thanks for tuning in, guys.